So guys, we're going to talk tonight about men's health. And this is a really important topic because men don't talk about their health, generally speaking. And so what we're going to be doing is we're going to be covering off a bunch of the things that are really important to focus on in regards to men's health and hopefully provide a bunch of light and inspiration to pay further attention to our health and also help other men basically pay more attention than what they currently do. So yeah, tonight, my name's Dr. Adam McKenzie. I am the founder of Chiropractic Life Australia. We have, I think it's 56 practices around Australia and New Zealand now. And I'm really passionate about health, just full stop, and creating more life within people's lives. And so at the moment, the healthcare system, I would suggest, is not a healthcare system. I would suggest that it's a disease care system instead, because people only seek healthcare for the most part when they're sick or when there's something wrong. And no one's worse than that than men. The old "she'll be right, mate," down here in Australia. I got this, just throw another log on my shoulder. I'll keep going. This is pretty pandemic for men worldwide. So tonight we're going to be focusing in on what we can do to really enhance that health. And I'm going to give you a little secret. It's basically don't lose it in the first place. So let's kick us off. Hi, I'm Lucky. And this is why for me, right? We're going to tell you a little story at the start and then we're going to finish it up at the end. So there was a little girl born, and the little girl has two diseases that no one else in the world has. She has a skin disorder such that she has dry and cracked skin all over her body. You can see how many layers are out by how closed over her poor little eyes are. You can see how dehydrated she is by how swollen her lips are and her poor little tongue. You can see the massive cracks and fissures that she has all over her body here. You can fit a 50-cent piece inside of there. The little girl's struggling to survive. They've got her wrapped in Glad wrap to try and keep the moisture in. The little girl also has a blood disorder that no one else in the world has. She has less than 20 platelets. Now, you guys know what platelets are. They're what stops you from bleeding out if you get a cut. It's what causes a bruise. If you have less than 20 platelets, you're considered clinically dead. It's game over. You're not going to survive. The little girl has less than 20 platelets on more than 24 occasions in the first 6 months of her life. And she has single-figure platelets on another 12 occasions. And every time this happens, she's rushed 5 or 6 hour drive to Melbourne for a life-saving blood transfusion. These are her poor little hands, and you can see how dry and cracked the skin is by how much it's pulling in on the ends of her poor little fingers. And you can see the massive lacerations around her wrist there. And these are her poor little feet. And the doctors, they want to amputate her hands and feet, but the mother's like a lioness. She's like, "You won't do that to my baby. She'll die intact." But amazingly, she survives. But she's like a kid in a bubble. She has to wear really padded clothes all the time and a helmet, because anytime she trips and falls, she's at risk of dying. And still every week or two, she's being rushed 5 hours by car to Melbourne for a life-saving blood transfusion. Now, why are they taking her by car? Can't they airlift her there? Well, they can't do that because if you go at altitude, it lowers the platelets further. Yeah, and she may pass. This little girl has more than 36 death sentences in the first 6 months of her life. She survives a little more. And you can see that some of the skin starts to clear up, but so in the hot areas of her body, like around her eyes, under her arms, her hands and feet, she still has these massive areas of dry and cracked skin. And she survives a little more. But she always has these massive bruises all over her body. And the family are from a small country town in the middle of nowhere. And basically, it's got 1,000 people there. And so everybody knows everybody. And when the family goes down the street, for example, to the supermarket, people look at the family because they think that the parents are beating the children, right? But you can see that she's growing into a beautiful little girl and she loves those lambs. But still every week or two, she's being rushed off for another life-saving blood transfusion. So I'm lucky. I'm really lucky. And so are each and every one of you. I want you to consider the health that you have today and the health that you have experienced throughout your life. And I want you to consider how amazing it is that you're as healthy as you are today given all of the stress that you've had, given all of the late nights, the hard work, the meals you've skipped, the big nights on the grog, all of the things that you've done that you know don't lead you towards further health. And men are the worst because we don't pay attention to it. But we're so lucky that the body heals itself and it allows us to be healthy, because not everyone gets that same chance. And we take it for granted that our body's always going to keep us in this state of health. So health is a journey. Picture your health as a path, one that you take throughout your entire life, through all the different stages. If you stay on track, you won't experience too many adverse health conditions. When we venture off track, because you're blokes, right? You like going four-wheel driving. This is where we start to see chronic conditions arising. This happens when we ignore our body signals, trying to tell us that things are getting progressively worse. Not everything is preventable. However, a lot of things are within our control, even though some are not. And when it comes to our health, it is the things that we consistently do with time that determines the health that we will experience long term. And there are things that we can do to stay on track, to look after our health, like moving our body in ways that you enjoy, managing stress, and nourishing your body and your mind to make sure that your body expresses the health potential that it was born to have. Because if you look backwards, and if you look at yourself as, for example, as a 16-year-old, most people would say that they expressed more health at 16 than they do right now. And the question needs to be, well, if that's the case, why are we sick right now? Why do we have less health? And tonight we're going to talk about that a fair bit. So there are different stages of life, right? Immaturity, puberty, peak, middle age, and maturity. And at those stages, different things happen. And these are really common ones in men. So depression is a huge thing. Chronic stress, leading to high blood pressure is another big one. Heart attack and heart disease are huge in men. And then Alzheimer's, dementia, and Parkinson's, as we move into later age. And you need to know that your body changes as you age. It's not the same in each and every stage. And what you do for one phase may not work in another. Our bodies are dynamic and not static. They change throughout life. Our lifestyle needs to be adaptable, from the food that we eat to the way we move. Our goal should be supporting, nourishing, and understanding our body as we transition through each of these different phases and embracing the changes as they come. But we need to get curious about what your body can do together, right, when it has the right environment. That is the right food, the right exercise, and the right mental state. So here's some men's health stats from Australia. So you can see that coronary heart disease is a big one. And you need to know that with all of the statistics that we see here, that 49% of males in Australia, no matter the age, have one or more of the 10 selected chronic health conditions. That's every second person. Every second bloke you sit next to at the pub has one of 10 chronic health conditions. Australian males lost more healthy years of life from dying prematurely, 54%, than from living with disease and injury. An estimated 89,000 new cancer cases will be diagnosed in males in 2022. And they're just the ones that are diagnosed, because men are the ones who are the slowest at going and seeking help. And in 2021, heart disease accounted for more than 10,000 deaths, followed by a dementia and including Alzheimer's disease. These aren't great statistics, guys. But what is the biggest killer in men under the age of 45? And I think you already knew the answer to this. Suicide is the leading cause of death for Australians between 15 and 44 years of age. 75% of those who take their life in Australia are male. An unknown number of Australians attempt suicide every year, with estimates suggesting this figure may be over 65,000 people. 43% of Australian males have experienced a mental health problem at some point in their lifetime. And you know what sucks? we don't talk about it. We soldier on alone, trying to cope. But I need you to know that health is a spectrum. And quite often when we're in this optimal phase, we think that we've got it all sorted. We have energy, pain-free movement, mental resilience, regular bowels, strength, fertility, flexibility, clear skin. But then if we just lose a little bit, we end up with anxiety, headaches, joint pain, high blood pressure, fatigue, body pain, obesity, depression, acne, poor sleep, autoimmune type conditions, or maybe even brain fog. I need you to note to yourself right now if you're noticing any of those body signals. These are signals that your body's giving you to say, hey, things are not right, guys. And ladies that are on the call, this is for your men as well, because it's likely that they're not here. It's a little sad tonight that there are as many women on this call as there are men. This dysfunction occurs when our environment has been such that the stress has been consistent enough for our nervous system to shift our physiology away from normal, and then we're starting to get groups of symptoms. If those groups of symptoms start to form these type of conditions, eventually there'll be enough symptoms to group them together and then label us with a disease. Because before it's a disease, it's dis-ease. It's a lack of ease within the body. It's like dis-function, lack of function. It's like dis-harmony, lack of harmony within the body. So I'm not sure if you guys are very apt with Zoom, but down the bottom there's a little function in the toolbar that allows you to raise your hand. So can everyone just try and do that for me, just so I can see that, you're able to do it? Because we're just going to get a little bit of participation going, right, for the next couple of questions, right? So Glenn's got it. Tanya's got it. Has everyone else got it? Who did we get there? Someone else put their hand up then. Yeah, Tanya, Tash, Josh. Yep.
You
Brian,
want us to them back down again, Adam?
Sorry, Tanya?
You want us to lower them back down again?
Yeah, if you tap it again, you put it back down. Good work. Awesome, guys. All right. So here's my question. Hands up if you know someone who seemingly out of nowhere, a man that you know, had a heart attack or a stroke. Okay, we've got half. Right, keep your hands up. And other people, put your hand up. And guys who have already got your hand up, has anyone you know, a man, gotten cancer seemingly out of nowhere? Right, so if you haven't got your hand up yet, you can whack it up now. Or if you've already got your hand up, you can go double hands up. I don't think you can do that on Zoom. So guys, that's basically everyone on the call. And so what I need you to know is this. These things are scary. You can pop your hands down too now if you like. These things cut people's lives short. And here's the sad truth, and I'm going to ask you a question. Do these diseases jump out of the cupboard and onto this person's back out of nowhere? Do they magically appear? Or, second option, do they develop slowly with time and we just don't notice them? Second option, right? Did you know that 85% of the time, the first symptom of the heart attack is the heart attack itself? You can say, wow. That's scary. And these are our brothers. These are our uncles. These are our fathers. And for some of you, these will be your children as well. Because the CDC did a study in 2009 that shows that children born after the year 2000 are not expected to live as long as their parents. So that means that some of the parents on the call here will see their children die before them. And these are scary statistics. And so I need to ask another question. Did the genetics change from the parents to the children? It didn't, right? So why are we so sick? because a lot of things have changed, right? Life has sped up. We spend a whole lot more time on devices. Because when I was a kid, I got locked outside until it was dark every night. There was no being inside. There was no computer games. When you go to the supermarket, when you guys were growing up at the supermarket, how many items were on the supermarket shelf compared to today? Were they all in pretty packets? Yeah, they even wrap up the apples in packets these days. These things are simply not designed to help us be healthy. And again, it starts slowly with a little dysfunction, a little disharmony within the body, a little lack of ease. And here's the funniest thing, right? If it was your missus and she was driving along, right, and the lights come up on the dashboard of the car, she probably kept driving. But you guys, yeah, take absolute pride and joy in your cars, generally speaking. And you'll fuss over them and you'll make sure that they're perfect. But when it comes to your health, we don't get the same attention nor respect. And I need you to really consider that, because you're ready for this. Even if you've got the most amazing car on the face of the planet, you can buy a new one, but you can't get your health back. I need you to be an advocate for your health. The health spectrum helps to show that often signs and symptoms appear over time. The problem lies with us when we continually ignore the signs. If we don't change the environment that caused them, then eventually our blood tests will show something. Eventually, an X-ray will show something. Eventually, it'll show up on the MRI, the CT scan. Just because you've been told that you're normal by one health professional doesn't mean that your health is in tip-top shape. Because before, we talked about those people who seemingly out of nowhere had heart attacks and strokes, true? We talked about those people who seemingly out of nowhere, got a diagnosis of cancer. Just because you don't feel it doesn't mean it's a problem. And if you're starting to feel it and you're ignoring it, then that's like putting masking tape over the lights on the dashboard of your car. Don't ignore your gut and when your body and what your body is trying to tell you. It's totally possible to have dysfunction that isn't chronic enough to hit the threshold for abnormal on a blood test. And you need to know that even the blood tests are only a snapshot in time. So here's a scale we're going to use to measure our health. And I want you to consider your belief system around health. So a lot of people fit over here in pathogenic. Who here has heard of pathogens? Yeah, cool. So pathogens, right, means, diseases. And so someone who focuses on the pathogenic view of health tackle issues as they arise. So you wait until there's a problem and then you jump on it, right, when there's a big problem. When we're here, we don't have a lot of resilience. We don't have a lot of adaptability. And we don't have to have many more things go wrong and it's game over. Then we've got symptom-based, which is basically when we get pains, we look to reduce those pains. The next is stabilizing. It's people who want to maintain what they got right now. And they might be doing maintenance care, on their health. They're just trying to hold on to what they've got. But this is not a great way to deal with health because of this. There's really only two ways your health can be going. You're either growing or declining. You're either in syntropy or entropy. There's no stasis in health, right? Homeostasis is a dynamic balance. Yeah, up, down, up, down, up, down. Same as heterostasis, up, down, up, down, up, down. The only time your health is static is when you're pushing up daisies. The next phase is functional, right? Which is looking to enhance your performance. You might be an elite footballer, cricketer, golfer. Yeah. You may love playing with your children and wanting to continue to run around with them for many years to come. This is functional-based health. The next is wellness, which is focus on well-being and the expression of self. How are we going to be more well? And the last is the opposite of pathogenesis. It's actually known as salutogenesis or salutogenic health. Hands up if on the call if you've heard of salutogenic health. Anyone? Tashi, Tanya, Alyssa, Taylor, good. Okay. So for those of you who've not heard of salutogenic health, what salutogenesis is the focus on human optimization. It's the focus on, if we did this, we would be an optimal human. We would have optimal expression. This is what is required for a human to be really, really healthy. And so if we're striving for optimal function, optimal expression, then we don't have to worry so much about pathogenesis, symptoms, and trying to stabilize, because we're always moving in the positive direction. So the next thing you need to know is that men are physical. Men are designed to move. Men are designed to roughhouse as well. When was the last time you had a wrestle and had a roughhouse with another bloke? Men are designed to have physicality in their lives. But men are more static and spend more time on computers, in utes, on tractors, and not moving now than they ever have before. When you think backwards and you think about your father and your grandfather and his father before him, generally speaking, there is a greater amount of labor and a greater amount of hard work done each generation you go back. So the other big thing is that there's more societal expectation on men to display less physical dominance, less aggression, less of the things that make men men. And with this being the case, this is actually very difficult for men, for their physical health, number one, but also their mental health, because it's actually a way of expressing how they felt. So let's talk about grip strength now. Research has shown that a powerful grip correlates with longevity. It's actually the number one sign of longevity, a good, strong grip. In 2015, researchers collected 142,000 grip strength measurements across 17 countries. The study suggested that for each 11 pounds or 5 kilos of decreased grip strength, there is a 16% higher risk of death. It's a predictor of overall strength of health, as well as cardiovascular disease. As you age, the stronger your grip, the more likely you are to survive the disease that you have. I want you to think of an older person who's in the hospital, who's a bit feeble. Do you think he'd have a good, strong grip? So this is why, and we're going to link this to chiropractic, because everyone's here. This is a chiropractic lecture. How many times have I spoken about chiropractic so far? None. Chiropractic's about how your brain communicates with your body. And grip strength is a great indication of how well your brain can talk to your body, because it's all about tone. Grip strength is about distal tone. And what I mean by distal tone is this. Central tone is how your posture is. That's how well you hold yourself up. Distal tone, you've heard of muscle tone before. Distal tone is how much tone you can get to your hands to do your work. So I need you to consider how much you're actually firing information from your distal extremities, right? If you're not moving as much as your father, his father before him, or his father before him. And the other big thing is this, and this stat's not actually in the workshop tonight, but we could probably find it and give it to you. Stats show that men, on average, die within 7 years of retirement because they lose purpose, they lose function, and they lose tone. And this is a scary stat. Just for another fun one. Boys will like this. Men who are married, live 7 years longer. And women who are married, they live 7 years less. Just so you know.
Unsurprising.
Unsurprising. We just traded you 10. So What does constant stress do? Stress is one response that can be activated by physical, chemical, and mental emotional triggers. So who here never feels refreshed? They feel like they have 330-itis all the time. They feel achy all over, but have not done the physical activity to warrant the soreness. They have 330-itis, or they feel like they have to sleep all the time. You need to know that this stress response is activated within your body when it's out of balance. Restoring balance by removing your physical, chemical, and emotional triggers will decrease your stress response. This will also relieve the inflammatory burden on your body so that your adrenals can replenish. So your adrenal glands sit on top of your kidneys. These are like the boosters for the Ferrari. It's what does the nitrous. It's what helps you get up and go. But who here feels like basically if there was a fight to be had, they just don't have the energy anymore because we're so fatigued. Yeah, we've let it go. I need you to know that inflammation happens when our homocysteine levels go high. Homocysteine in the body means that we have elevated levels of inflammation. And this occurs when we have depletion of vitamin B6 and B12. Vitamin B6 and B12 get depleted when we have chronic stress because they're used to build cortisol and adrenaline, our stress hormones. They're used up in that process. So I need you to have a think about your life and where you spend the majority of your time. Do you have more rest, digest, and healing in your life, more relaxation? Or do you spend more of your time in fight, flight, and defend, in survival mode? So who here spent more than 50% of their time in fight, flight mode in the past 12 months? I'd have to put myself in that category. Did you know that you're actually only supposed to spend 5% of your time in fight flight system? And the more time you spend there, the faster your body is breaking down. It's not healing. It doesn't have the ability to repair the way that it would normally. So we should be dominant in terms of rest. I need to now talk to you about sympathetic dominance. We have a couple of divisions of the nervous system. The first is somatic and automatic or autonomic. The somatic part of your nervous system is the 10% that you can move and control consciously, the things that can hurt. 90% of your nervous system is autonomic or automatic in its functions. Who here has heard of left arm pain and heart attack? This is because the nerves that come out, in the upper thoracic region here, they come out and go to your left arm, but they also go and supply the heart, the sympathetic and parasympathetic branches. We're supposed to spend most of our time in our parasympathetic system. When it says sympathetic dominance, what this basically means is stress. We're stuck at 6,000 revs in neutral. You're like a duck. You're very calm on the surface because you don't want anyone to know, but underneath the surface, the duck's little legs are going a million miles an hour. Do you suffer from any of the following? Acute levels of stress, anxiety, obesity, sleep issues, poor gut health or irritable bowel, poor posture? These things are very, very common in men. These symptoms are all linked with a heightened sympathetic nervous system. There's a great book that I'd like to recommend for you. Ash might put it in the chat. It's called Sympathetic Dominance or SD Protocol by Dr. Wayne Todd. It's a great book. There's also a lecture on YouTube that goes for an hour and 36 minutes where he discusses it if you'd prefer to watch it in video form. You want to skip the first 16 minutes of that, okay? Because he's just getting it ready and talking about himself. Stress response increases cortisol and catecholamines, your stress hormones. It increases your heart rate and your blood pressure. It increases your blood lipids, blood glucose, and insulin resistance. What does that sound like, guys? It sounds like diabetes. Did you know that you can be as skinny as me and end up with type 2 diabetes? Why? Because insulin resistance and high blood glucose shuts down your pancreas. There was a condition back in the day called adult onset diabetes. And it was called adult onset because the onset was more in adults. It's now called type 2 diabetes. Why is it called type 2 diabetes? Because the onset is more in the children now than the adults. Again, did the genetics change from the parents to the children? And the answer is a simple no. It didn't. These things happen slowly with time. You may have heard the analogy, if you throw a frog in boiling water, he'll jump straight out. But if you put him in cold water and you bring it slowly to the boil, he'll never notice. This is just like men's health. Respiration rate increases and bone loss increases. Now, a lot of you have heard of osteoporosis and osteopenia, right? Where did the osteoporosis and osteopenia come from? Let me tell you. When you're under chronic stress, your body has to choose between survival and everything else. Metabolism, digestion, immune system function, reproduction. It has to choose what it's going to do. And in every one of those cases, if the body has to choose between survival and metabolism, it will choose survival. If it has to choose between survival and digestion, it will choose survival. If it has to choose between survival and immune system function, it will choose survival. If it has to choose between survival and reproduction, it will choose survival. And it will strip from the body whatever's required to build these stress hormones. Cortisol, and our adrenaline, which is the system, which is our catecholamines. And so we will strip the calcium, the magnesium, and everything else out of our bones that's required to build those stress hormones. So grandma got osteoporosis. Why? Because she was chronically what? Stressed. So the stress response also decreases things: digestion, metabolism, serotonin. Serotonin is your happy hormone, along with dopamine. It decreases your short-term memory. Who's heard of Atlas before? Atlas was the bloke in Greek mythology who had the world on his shoulders. Atlas is also your top vertebra. And when we're operating normally and at rest, our Atlas will sit on a 45-degree angle. Now, the reason I'm going side on and the reason I'm holding my hand up like this is Atlas is a hoop and it sits on top of a peg. And it should sit on a 45-degree angle like this. When we're chronically stressed, Atlas levels out. And if it gets really bad, it will tilt to the side and we'll be able to see both sides of it all clean through it on a lateral X-ray. This is really common in people with ADD, ADHD, Asperger's, autism, or people with PTSD. And when you speak to your chiropractor, you can talk to them about your Atlas relative angle. And what you're going to notice is a lot of tension in your suboccipital muscles. You're going to notice that you can't think clearly. You're going to notice that you have brain fog and you forget things and your concentration's down. Because when this happens, it reduces blood flow to the brain, and the research shows by around 80%. Why? Because your vertebral arteries go through the Atlas. Growth hormones decrease. Cellular immunity decreases. Concentration, like we just spoke about, decreases. And in men, testosterone decreases in stress. People with stress and anxiety disorders are more likely to suffer from fatigue, difficulty getting up in the morning, peaks and troughs in their energy, muscle weakness and lethargy, increased inflammation, eczema, psoriasis and brain fog, thyroid dysfunction, dry skin, and metabolic disorders. Sleep issues is a big one, though. Sleep issues is essential to support good health. Getting enough sleep helps to regulate your appetite, metabolism, mood, immune system, hormonal function, and cardiovascular function. When a body's in fight, flight, and stress response, it releases hormones such as adrenaline and cortisol, which disrupt sleep patterns. Nearly 40% of Australians suffer from inadequate sleep. 1 in 3 experiencing poor sleep quality. 1 in 5 Australians suffer from sleep disorders such as insomnia, sleep apnea, and restless legs syndrome. So let's explain where some of these come from. If we're in sympathetic dominance, if we're in chronic stress, what our body does is it thinks that we're walking through the forest and a tiger's going to eat us. And so what happens is our body makes us hyper aware. It starts to open up our senses to take in more of the information from our environment. And so if there's a little twig snap over there, I'll pay attention to it. If leaves ruffle over there, I'll pay attention to it. If there's a squawk back there from a kid, I'll pay attention to it. Why? Because it could have been a twig snapping because the tiger was creeping up on me. It could have been leaves rustling over here because there was something in the bushes. It could have been a squawk back there because the bird was being startled by a predator coming up behind me. We pay attention and more attention to all of these things, and our sleep is lighter. Point 1. Restless leg syndrome, point 2. When we're in chronic stress response, our red nucleus fires. The red nucleus fires up the muscles on the front side of the body up the top here. And then it fires up the muscles down the bottom here, glutes, hammies, and calves, when we're under chronic stress, because it pulls us forward and our hammies and our calves are pulling us backward. When this occurs, we build up lactate or lactic acid within our legs. When this occurs over time, and then we don't move enough because a lot of us have sedentary jobs now, what happens is when we get to nighttime, we still have the buildup of lactic acid. Our body hasn't been able to pump it out. And then we end up with restless legs and cramping in our legs at night. Restless leg syndrome, is akin to chronic stress. And the other thing that, happens here is, like I was talking about with the osteoporosis, we're using all of the minerals, we're using all of the little resources to build stress hormones instead of to have normally functioning cells and muscles within our body. Sleep apnea, is an interesting topic. There's a big school of thought that the soft tissues in the back of the throat, and the tongue actually get floppier, like what happens in sleep apnea, under chronic stress. Why would this happen? Because if you're under chronic stress and it's caveman times, your body is intelligent and it actually wants you to stay in the cave for longer to recuperate and recover. And so if you're feeling kind of not up to it back in caveman times, you just stay home. But today, work is a daily thing and you got to go. And so we keep on keeping on. We don't rest. And so in such things, we just do it tired. Sleep apnea is your body trying to tell you that you need more rest. And so it's going to try and make you get the extra rest, because it's hoping that by telling you that I feel tired, that you might just listen. These statistics are concerning, as poor sleep can lead to a host of physical and mental problems, including obesity, diabetes, depression, and anxiety. It's shown that if you have less than 5 hours of sleep, that you will have the blood readings of a pre-diabetic. It's shown that if you have less than 5 hours of sleep, that your blood, that your alertness and reaction times are similar to someone who has between 0.05 and 0.1 blood alcohol reading. Men, this is where we lose our brothers. This is where we lose our cousins. This is where we lose our uncles and our fathers, because we keep soldiering on, even when we shouldn't. Ladies, this is where you lose your boyfriends, fiancés, husbands, and partners, and everything, all the other groups I said before. And it's not okay. Subluxation is a chiropractor's word, and it also disrupts the body's ability to regulate sleep, leading to insomnia, restless sleep, and other disorders. Chiropractic can offer many benefits for individuals struggling with sleep problems. It helps to address the subluxation and the underlying cause of the sleep disorders. It helps to reduce the pain and discomfort so that people can fall asleep and stay asleep rather than rolling over and waking up. It helps to regulate the nervous system, reducing the overactivation of the fight-flight response and promoting more restful sleep. One of the most common things that we get back on our first progress exam forms when people come to the chiropractor is, I can't actually believe how much better I sleep. It's literally the most common thing people tell us. I have more sleep and I've got more energy. And I think that those two things probably go together. because what's happened is we've taken you down, a couple of thousand revs. We've shifted back a gear or two. Heart health. Chiropractic can help with reducing blood pressure. It's shown that an atlas adjustment, is significantly important in reducing blood pressure because it has a direct effect on the brain stem. Your brain stem controls all of your vital responses: heart rate, respiration rate, blood pressure, right? And it also controls sleep-wake patterns like we were just talking about. A 2006 study demonstrated that patients seeking chiropractic care for pain had significant reductions in heart rate variability and other cardiac measurements after a single chiropractic adjustment. Just one. Chiropractic supports cardiac nerve function. Researchers of Italian Review study found that spinal adjustments through care help to regulate the nerves that ran outside of the brain and down the spinal cord to help counterbalance the overacted nervous system. The vagus nerve, or the gut-brain axis, is also considered an effective therapy for severe depression as it releases chemicals in the body that are important for fighting depression. The vagus nerve is the main nerve that also supplies all of the other visceral function, other than the ones that come out of your spinal cord and go directly to the heart. This is really important. Who's heard of gut-brain axis? Hopefully some of you. Yeah, this is the main nerve that we're talking about there. So, mental health. Studies have been conducted to test the correlation between chiropractic care and its impact on mental health. The results have shown really significant and positive changes in the patient's mental well-being, including reduced stress levels. Please note that if you're suffering from depression or anxiety, it's important to seek proper health professionals, right? Recommendations around this, because we can't say that we treat any type of anxiety or depression. However, having about a decade of clinical practice, I can safely say that when people get adjusted consistently, these things have been shown to improve consistently with time. That's the consistent feedback we get. However, chiropractic management isn't a cure for mental illness. It is an alliance with advised medical treatments, and it can significantly help improve practice members' mental well-being. So reflection. If you reflect on your current lifestyle, on how you feel within your body right now, I want you to ask yourself, are you on track? Or is there something that's just under the surface that doesn't feel right? This could be the first sign that you've taken a wrong turn somewhere. The good news is it's never too late to make changes. Our body's adaptable, particularly when we're consistent. And then the next question is this, if you continue to do exactly what you're doing right now over the next 5 and 10 years, will you be as good in 5 and 10 years as you are today if you eat the way you do, move the way you do, think the way you do, and accept the health that you have right now? Or will you decline? Hands up if you will be better in 10 years. Great work, Brian Patrick. Will anyone else be better in 10 years than they are right now? Good work, Alex Rodwell. Good work, Tanya. Here's a little more on the mental health, guys. Chiropractic adjustments help to reduce pain. They help to reduce chronic pain, and regular adjustments improve spinal function and posture. These all have a direct impact on how people consider themselves, perceive themselves, and their ability to interrelate with the environment. What I need you to know is this. You have proprioception. Pro is positive, and you have nociception. No is negative. This is the movement when you have full range of motion and your body's working really functionally well. This is when you've lost range of motion. And so if you don't move like you used to in your teens and 20s, right, you now have nociception, which is negative feedback, which induces a stress response within your body. Getting your body moving is one of the keys to remaining healthy as a man. Body signals is what we need to be paying attention to. And instead of treating symptoms as an inconvenience, I want you to first think about your body is trying to tell you before you cover it up. You know, I've always been one to think about this when it comes to physical symptoms like headache, pain, skins, rashes, acne, and sleep. But it's only until recently that I started seeing my emotions as symptoms too. Often when we feel those unwanted feelings like anger, sadness, guilt, shame, we avoid them. This is basically the same as covering up your physical symptoms. Emotions are neither good nor bad. They're just our way of our body trying to communicate with us. So for instance, with anger, this means that a boundary may have been crossed. And if you consistently experience anger, you'll start to clench. You'll start to notice you have jaw pain and potentially headaches. And when we have repressed anger over time, we end up having grinding things with our teeth. It leads to things like liver issues, and it really changes the overall function of the body. So next time you experience a physical symptom or an emotion, take a moment to ask yourself, what is my body trying to tell me? So there's some ways that your body talks to you. Headaches, pain, inflammation, self-talk, and posture. We're going to cover these off quickly. So headaches. When you're wound up, busy, and stressed or unable to relax, your brain thinks it's in fight flight. It thinks that it's got to run away from the tiger. During these times, the neurons in the brain let in more light and noise. Remember when I talked about walking through the forest and you thought that the tiger was going to eat you? You're letting in everything, right? And this makes it really hard for your body to relax because you're attending to everything like it's a threat. The problem with modern life is we stay in fight, flight for far too long, and the consequences of this are many. Sensitivity to light and noise is just one of them. So hands up if when the kids come home and they're squawking and screaming, you just want to lock them in the cupboard or you want to send them outside. Or if someone's clicking their pen, you just want to stab them with the pen. Yeah? What about that tiny little light that's on the TV or on the air conditioner when you're trying to sleep? And that little light drives you up the wall and all you want to do is smash it or put a sticker on it. So the sound version is overfiring of what's called the inferior colliculus. The little light is overfiring of what's known as the superior colliculus. And if you want more details on that, please read that book that that Ash has popped in the chat, or watch the lecture that's on YouTube. Right? It's quite amazing. Yeah, these are both by Wayne Todd. Diet can also affect your headaches. So basically, I want you to know that your stress being in the stress system long term depletes a bunch of the body's micronutrients and resources for it to function optimally. We've already spoken about this. And headaches is another one of the ways that your body might be telling you, that this has been happening for way too long. And that we've got stress hormones that, within the body, and we need to be able to try and mop them up. Now, headaches like the siren going off saying, come on now, please pay attention. You've been here for too long. Then we have the sympathetic dominance headache. This is generally around the base of the neck and it radiates up and over to the forehead. It might even become in a hat band. This generally occurs when we've been really neurologically wound up and our brainstem, is really, really on edge. And quite often you have random other symptoms. Quite often this happens when you're on the come down from the really stressful event. So e.g. it's 3:30 or e.g. it's 5:30, you finish work and then all of a sudden it hits you. Because when you're in the fight, you don't notice the pain. It's when the pressure comes off that your body tries to heal you. And the headaches of your body asking you, please don't go back into that environment. Pain. Pain tells us many things. The tricky thing is it's subjective. And so what I need you to know is this. Pain is actually an emotional response to a stimulus. And if I cut the nerve here and then I start pricking my hand, I can't feel it. The more stress you're under, the more pain that you will experience. This is where we start to notice syndromes and things like that. But I need you to know that pain's not normal. Back pain's not normal. Headaches are not normal. Yeah, and other bodily pain is not a normal thing. If you didn't have it when you were 16, you shouldn't have to have it now. And common things in men are, I'm getting old. Common things in men are, it's genetic. Well, let's debunk both of those right now. Number one, if a sperm meets an egg, right, and I don't have to go back and tell you men how that occurred, do I? Yeah, you know how that happened? Good. So when a sperm meets an egg, we have one fertilized cell. If that fertilized cell divides and it builds two humans, what type of twins do we have? We have identical twins. And so with these identical twins, they have 100% the same genetics. And they're usually born within 3 to 5 minutes of one another. And so over time, these twins can end up with very different health statuses, even though they have 100% the same genetics, point one. And then point two, even though they are born at basically exactly the same time. Now, this can change epigenetically for sure, but that's not what we were talking about, because most people, when they say things are genetic, they're like, oh, my dad passed it on to me, that's why I got it. Oh, my mum passed that on to me, that's why I got it. And the sad part is that that's actually bullshit. You can't use that as an excuse anymore. And if you want to know more about that, yeah, please get yourself in for an appointment and have a chat with one of our amazing chiropractors, and they can talk you through sympathetic dominance. Or, yeah, what we can talk you through is Epigenetics by Bruce Lipton. Yeah, and we might even be able to pop that up in the chat too. Yeah, his book's called The Biology of Belief. And there's also a lecture that goes for around 2.5 hours on YouTube. This is the frontier of health science. Sympathetic dominance, neuroplasticity, epigenetics. This is what we should be talking about. But most men won't even go and seek help from a health professional at all. Inflammation. I spoke about this earlier. Homocysteine is the marker of inflammation within the blood, and it's generally down to a lack of vitamin B6 and B12, which are usually used to help lower homocysteine levels. These levels have been linked to increased risk of cardiovascular event, Alzheimer's, dementia, and Parkinson's. And so it's important to make sure that we're getting enough of these vitamins, and better still, that they're able to be absorbed. So why might you be deficient in these things? Chronic stress, number one, not a great diet, number two, gut function, and an underlying liver processing issue. Self-talk. Self-talk for women is terrible. Self-talk for men is just as bad. We just don't talk about it. We're always beating ourselves up. The hustle culture is real, but so is burnout. And I need you to understand that rest is productive. Without it, you can't get anything done. Switching the way that you not only view things, but the way that you speak to self is the first step to develop a mindset, one that will serve you for the rest of your life. So I want you to swap this for that. I need to exercise to get back my six-pack and lose my beer belly. I get to exercise to feel stronger and healthier. Obviously, that is much better than this. I need to work harder so I can provide for my family and give them the life that they deserve. I have enough. Quality time with my family is more valuable than buying stuff. I feel so lazy. I haven't achieved anything productive today. Rest is productive and I deserve to rest. If I asked you who's guilty of this and don't give yourself enough of that, I reckon you can all put your hand up. I'm in that category too. So you're not controlled by your genes. You're controlled by your beliefs, your thoughts. Change your thoughts and change your genes. It's proven. Epigenetics is the forefront of health science. The pharmaceutical companies don't want us to talk about this though. And so please, if you're really interested in health, make sure you deeply look into epigenetics. Bruce Lipton's a gangster. And if you'd like a shorter version, there's around a 10-15 minute clip by a lady named Nessa Carey. It's a TED talk, that you can really tap into. It's really quite amazing. She explains it with lolly snakes and marshmallows. It's quite cool. Posture. Sit up straight or we get a hunchback. said every mother and grandmother ever. Turns out that they were right and they knew what they were talking about, right? When posture is right, messages flow up and down the spinal cord, yeah, perfectly, and out to every other nerve in the body. Good flow of these messages, yeah, are really, really important for every function within the human body. The reason that we get the shitty posture is, like I spoke about earlier, with the firing of the red nucleus and it pulling us forward. And we spend so much time doing this. Did you know that if you're in that forward posture, tapping at the keys, driving the car, you're actually firing your stress response by being in that position? It's extension positions, right? Which is drawing your shoulder blades together, lifting your chest and pulling your arms back. Or down here into Brugger's relief position. That's Bruggers, Brugger's relief position. These help to fire your parasympathetic nervous system and help you be healthy. I need you to know that your posture really matters, and posture leads to overall structure with time. Man, is your body right now whispering to you, saying you need to change a few things? Has it started to talk to you on a regular basis, saying this, yeah, something's not right, mate? Or is it shouting it at you? Is it shouting at you, telling you to get your fat ass off the couch? Is it shouting at you, asking you to get in and go and see someone? These symptoms or body signals that your body is producing, is your body trying to help you? But the worst thing with men is that we consistently ignore them. We've spoken of a few of these already tonight. We spoke about our adrenal function and how they're boosters for the Ferrari. We talked of thyroid dysfunction. We talked about whether our body chooses survival or metabolism. We haven't spoken about estrogen and progesterone ratio disturbances because that's for our lady friends. Yeah. But when they have this going on, yeah, these problems, yeah, come out of their mouths and into our ears and give us a headache. Yeah, so yeah, lady friends under stress are no good either, guys. Leaky gut is really common in men too. Shoulder and neck tightness comes from firing of the red nucleus. We talked about the sensitivity to light and noise as the superior and inferior colliculus, the clicking of the pen, the squawking children, yeah, or the little light that's on in the bedroom. Headaches and migraines we've covered. Brain fog comes from a lack of blood flow to the brain because Atlas has changed its angle. Light sleep and vivid dreams, yeah, fit that same category. Anxiety and depression, digestive upsets, bloating, diarrhea, and constipation. Increased risk of stroke and heart attack, inflammation, gallbladder disturbances, hormone imbalances, infertility and sex drive disturbances, uterine fibroids, fatigue, and difficulty losing weight. Please don't ignore the warning signs and symptoms that your body is giving you. You wouldn't ignore them if they were in your car. And you can replace your car, but we can't replace you. Studies show that the father's health dictates the children's health. So if you won't do it for yourself, do it for your kids. Generally, you're the hero. Generally, they just want to be just like you. And what you do in terms of your physical activity, what you eat, and the way that you speak, this is role modeling for them. And it's really important. So I need you to move well, men. I need you to get at least 30 minutes of moderate level activity at least 5 times a week. And this is not incidental through work. This is going for a good walk or a jog. That's number 1. Number 2, I need you to get 20 minutes of vigorous level activity at least 3 times a week. This is where your heart rate's up. This is where you might start to sweat a bit. 3 times a week for 20 minutes. And the last one for move well. Moving your body is essential for the correct hormone production, and it is essential for continuing to have your body serve you long term. If you think back to when you were 16 and how much less you move right now, How hard is it to get that back? It's really difficult, right? You got to work really hard at it to try and get something back. And where you're at right now, if you let yourself slip from where you are right now, it's going to be just as hard to get back the bit that you lose in the next 6 months, 12 months, 24 months of not doing the right things as what you've already lost. So move your ass, get off the couch, be a role model for your kids and your family. Eat well. Too often men skip meals. Too often men, just have whatever they can get their hands on. I need you to eat living things. Things that are close from paddock to plate, ocean to plate. And I need you to eat every color in the rainbow as the second point. Living things in every color of the rainbow. And last but not least, if you own a microwave, chuck that goddamn thing in the bin. The only thing it's good for is heating up a wheat pack if someone's got, a sore tummy because they're on their cycle. There is no positive health benefits for you eating food after you've nuked it. They call it nuking it for a reason. Think well. What chance is this poor little fella, this yellow fella, how chances has he got to stay and happy hanging around with all these fuckers? Probably shouldn't have sworn then. Anyway, bad luck. What chance has he got to be happy? He's not going to be happy hanging out there, is he? So, you know that bloke or that lady. You know that person in your life. Chop them. Get rid of them. You can't save them. Happiness comes from the inside. It's a choice. That's number one. Number two, I really would love you to, again, be a role model for your children. I want you to practice gratitude and wins. When you practice gratitude every night, right, ideally at the dinner table, it grows the part of the brain that makes you happy. So practice gratitude, guys. And number three, I'd love you to try and avoid antibiotics where possible. I'd love you to go and see your chiropractor and ask them, what can I do differently instead of taking these antibiotics? Did you know that if you take antibiotics for an infection, it increases the incidence of a repeat infection by 63%? If you go back into the same environment, the chances are you'll get another infection. If you have a second infection, what's the medical treatment generally for a second infection? More antibiotics, right? Did you know the studies that show that if you have 2 lots of antibiotics in any given year, right, you need to look up Zach Bush, MD, right, to find this study. If you have 2 lots of antibiotics in any given year, it increases the incidence of anxiety attacks by 44% and major depression by 52%. Why? Because we threw a grenade into our gut. It killed a whole bunch of the diversity of the bacteria in there. Because 90% of your serotonin is produced where? In your gut. 40% of your dopamine, your other happy hormone, is produced in your gut. And 50% of it is produced in your kidneys. 90% of your happy hormones are produced below my hand. The other 10% of the serotonin and dopamine are produced in your brain. Is it a mental health condition or is it a gut diversity of bacteria condition? You have to start to really ask yourself that question when you know these stats. Right? Again, look up vagus nerve. There's an amazing human called Stephen Porges who wrote a book called Polyvagal Theory. Polyvagal Theory. Now, that's a really heavy read, but he's got some really cool YouTube clips about the vagus nerve. Polyvagal Theory by Stephen Porges. Function well. To function well, our body needs a few simple things. We need to eat well, we need to move well, we need to think well, and we need a fully functioning nervous system to be able to remove the information from our environment into our bodies via the senses to our brain, so we can perceive it and integrate it, and then to form a response so we can shoot it out to the body, and then we can get feedback from the body and return it to the brain to complete the loop. Functioning well requires that the nerves, like electrical circuits, complete the loop and they earth again. If we have subluxation, which is a chiropractor's word for nerve interference, this cannot occur optimally. So we need to talk about brain-body connection. We need to talk about how the nerves, take information from the brain to the body. And if these nerves are unable to take the messages coherently, if there's disharmony, dysfunction, disorder, dis-ease within the body, over time, the organ system won't function at its best. A disease is but a group of symptoms. The symptoms come from the physiology acting abnormally. The physiology acts abnormally if the nervous system tells it to. The nervous system changes the message if there is interference. It's that simple. Your spine is a suit of armor. 90% of the stimulation and nutrition to your brain comes from movement of your spine. I'd love you to look up a guy called Roger Sperry, who won the Nobel Prize in 1981. He won the Nobel Prize for health. Who's heard the old saying, if you don't move it, you lose it? If you don't use it, you lose it. That's where that comes from. Again, subluxation. Let's break this word down for those of you who don't know. Sub means less. Lux means light or energy intensity, and ation means process. And yes, I know that the medical doctors and medical system and the pharmaceutical companies, put a new definition on subluxation and said it was a partial dislocation, but they didn't learn Latin. The original definition was less light, less energy able to travel from the brain to the body and back again coherently. In simple, if this bone doesn't move, this nerve can't talk properly from the brain to the body or the body back to the brain. It's like a blown fuse. It can't work at 100%. We have our 10% over here, which is our somatic nervous system. Then we have this half over here, right, which is actually accounts for around 90% of the function, the sensory nerves and the ones that go to our organs. This here is the autonomic nervous system. I'd love you to print one of these out and put on the fridge. This one here is called a Merrick chart, and you can trace the symptom via the nerve back to the spine. Does it work perfectly like that? Not exactly. However, it's still a really good general overview of where the nerves go to. I want to tell you a story about James. James was a miner in Darwin. I spent a lot of time up in Darwin. James was a FIFO worker. He worked 4 weeks on, 1 week off. 1 week to spend with his family. When he was on, though, he did 16-hour days. From the time where he got up, got ready for work, got on the bus, went out to the mine, got back home, had his dinner, and went to bed. James was chronically stressed. He was also chronically depressed. He had severe low back pain and significant headaches and migraines. James came in and we did a proper history, a proper examination, and we took some x-rays. His atlas was bang on horizontal. The other thing for James is that things weren't good at home. The kids were unhappy and the wife were unhappy. They weren't seeing him a lot. And when he came home, all he wanted to do was sleep. After we took the x-rays of James, we explained to him, this is exactly what we need to do to get you back on track, to get your body back to stable. We then went about adjusting James 3 times a week over the next 12 weeks, at which point then we did a re-x-ray and we're going to show him his x-rays again. It was on that appointment where we crossed off all 10 of James's goals. He didn't have the headaches anymore. He didn't have the low back pain anymore. But better, he was sleeping better. His mental health was better. He had a better relationship with his children and his wife. But something happened that floored me. James shared with me that had he not came in to get his body checked, that he decided that after he saw his kids for the next time, that it was all over. He told me that he'd been going to commit suicide. And he thanked me so much for giving him his life back. And I told him straight that I don't fix things. All I do is remove the interference and the body heals itself. And then he needed to be proud of himself for committing to doing the care, committing to do the home exercises, committing to changing his lifestyle to be healthy. James quit his job in the mines because he wanted to spend more time with his family. It was more important to him to be healthy than to be away for 4 weeks at a time away from his children. There are 3 reasons why we're in a health crisis. We're not as responsible as we should be. We have the wrong definition of health because we just believe that being healthy means we don't have symptoms. And the third reason is, men, that you're guilty. You procrastinate. You don't take action. Taking action means moving better. It means eating better. It means thinking better. It means having a clear nervous system so that your nervous system can integrate the other 3 things. So tonight, we'd like to take away the procrastination. We'd love to offer you the chance to get checked. We'd love to offer you the chance to lead your family to better health. We know that the health of the father determines the health of the children. The way that we do our initial process at Chiropractic Life is this. We will sit down with you one-on-one and do a full and proper history. We will do a proper nervous system examination and assessment with chiropractic, orthopedic, and neurological testing and find out exactly what's going on. We want to find the root cause. We'll do a postural assessment. And then if clinically indicated, we'll take some x-rays, because to see is to know, to not see is to guess, and we don't want to guess with your health. Then we'll sit down with you and explain exactly what we found. Now, sometimes it's our job. But if you've got something like a dicky knee, I'm probably going to send you the physio. If you've got, something really, really funky, I'm going to send you back to the MD. But a lot of the time, we can help with a lot of things, and not just your back pain, neck pain, and headaches. If you're chronically stressed and your nervous system's really wound up and you're nervous, where do you think nervous comes from? Wound up nervous system. If you notice any of the things that I've been speaking about tonight, we would love to help you. And we would love to help you lead your family back to health. We want you to be around for many, many years to be able to support and provide for your family. Once we've given you the recommendations for what you can do, what we can do to help you, how long it would take, we will also discuss with you what it would cost, and there will be a start point and an end point to the care plan so that we can remeasure it. That's how we do things. Men's health is a vitally important topic, guys, and I'd love to thank you for spending your time tonight listening. Thanks for getting on, and hopefully we see you next month. I think there's one next month. We should check that with Ash. And what that is. Please jump in the chat before we log off and grab those resources that Ash has popped in the chat. Thank you so much. Hope you have a great night. We'll catch you later.